Hi, I'm Carol Fraser, bringing you Organic Investigations, and today I'm going to talk to you about salicylates. Now, salicylates are found in our foods, our plant-based foods, and also in our products. Now, before I do, I want you to stay to the end so that I can tell you how you can find out how you can win a £500 luxury shopping budget. So let's get started. Now let's start with what are salicylates, and I've made a few notes here because there are many findings that I found out about salicylates, which is going to be really important for people who've tried everything and they're having constant flares. Now, salicylates are a factor in the cause of eczema sufferers. For people who are having constant flares, and you may be one of these people that have been battling and you've tried everything, and maybe you've changed your diet, maybe you've even made tweaks to your lifestyle, and you've tried every ointment, cream, lotion and potion, and nothing seems to be helping you, and you still seem to be battling these flares. Well, salicylates are a natural pesticide that are found in some fruits and vegetables, nuts, teas, fruit extracts, as well as even wine and herbal medicines and spices. Artificial and natural salicylates are also present in many skin creams, perfumes, and it appears in the main ingredient in aspirin. Now, aspirin is used to prevent inflammation, but it also contains these salicylates. So if you're taking aspirin in order to take down inflammation, you might find that the salicylate content could be one of the triggers. Salicylate extracts have been used medicinally for thousands of years, and however, salicylates have been linked with inflammation and possible cause of why you're getting constant eczema flares. Despite everything, you're still battling the debilitating symptoms, and this might be why. Now, you also might ask, why are salicylates in plant foods? Now, salicylate is a chemical made by some plants as a natural pesticide for protection against bugs and disease. These salicylates have preservative properties that reduce food spoilage as a preservative in your food. Eczema sufferers commonly have adverse reactions to preservatives and pesticides, so it didn't surprise me that this may be a possible cause for some who are suffering with eczema. And furthermore, salicylates trigger responses in systemic symptoms which affect the whole body. Now, here are some examples that I found. It can cause lack of energy, headaches, IBS, anxiety, ADHD, mood swings, nausea, vomiting, stomach bloating and discomfort, cystitis, asthma, irritability and restlessness, allergy symptoms like stuffy nose, runny nose, nasal polyps, frequent throat clearing, slow to talk or slow growth in infants and children, sleep disturbances, difficulty sleeping at night, night tremors, frequent night waking, sleep apnea, bedwetting, anxiety, panic attacks, depression, rapid heartbeat, tetanus, joint pain, arthritis, not to mention triggering the horrible symptoms of eczema. Now, please note that these conditions may be caused by other factors, so you should seek advice from your doctor and then investigate the possibility of salicylates. Now, both natural and artificial salicylates, if consumed in large doses, can cause health problems in anyone. For example, an aspirin overdose. And I often take aspirin even after gym workouts. However, people with salicylate sensitivity react to regular amounts of salicylates that are found in foods. For example, they react to coconut, tomatoes, and avocado. Often people don't know that what is causing their flares because they're eating these foods every day. And nightshade plants are particularly high in salicylates, except for peeled white potatoes. So this may be why some eczema sufferers report of having adverse symptoms to nightshade foods. Now I'm going to give you a list in foods that are high in salicylates. And these are bell peppers, hot peppers, sweet peppers, spices that come from peppers such as cayenne and paprika, eggplant, potatoes, except sweet potatoes, tomatoes, broccoli, cauliflower, cucumber, mushrooms, radishes, spinach, courgette, and even fruit juice. The salicylates in fruit juice, fresh fruit juice, are found in concentrated juices. Now I'm going to talk about topical steroid withdrawal and salicylates. Now salicylates, once consumed, also dilate the blood vessels, and this is why aspirin that may be prescribed for inflammation could be a cause to your flare-ups. If you have topical steroid withdrawal syndrome, it makes sense to reduce your intake of salicylates as part of your treatment. The reasoning is that the topical steroids constrict the blood vessels, and after years of use, there is a rebound reaction where you stop applying the steroids to your skin, and the withdrawal causes your blood vessels to excessively dilate. Now, research shows the excess dilation seen in topical steroid withdrawal patients, and it's caused by excess nitric oxide in the blood. And this excess blood vessel dilation in topical steroid withdrawal is likened to rosacea, according to Indian research. Now, rosacea is caused by an excessive widening of the blood vessels, where the excess blood flow causes the skin to appear red, hot and inflamed, much like TSW, red skin syndrome. Rosacea can become permanent if not treated with a low histamine or low salicylate diet and exercise. However, topical steroid withdrawal symptoms do reverse after a period of time where topical steroids are excluded. Now let's look at the research. Now, according to a study published by the Department of Dietetics, Institute of Human Nutrition Sciences in Warsaw, University of Life Sciences, 30 patients were diagnosed with NSAID hypersensitivity, and that is non-steroidal anti-inflammatory drugs. Now, participants took part for a period of 2 to 4 weeks. Diet adherence and salicylate intake were measured, and the severity of symptoms improved significantly after the intervention, which is interesting. Now, I will link the references in the description below regarding the effectiveness of personalised low salicylate diet in the management of salicylates, hypersensitive patients, interventional study, and I'll also link put a link to the reference for aspirin intolerance and salicylates. Now, several researchers in the 1970s reported that diets designed to exclude foods containing salicylates and or additives induced prolonged remission of skin rashes in those patients who had shown a positive response to oral challenge with these compounds. And that's reference Swain, 1988. Now, it's been known for more than a century that aspirin ingestion could trigger skin rashes, and this is found in reference Hirschberg, 1902, and I will put all the references in the description. Other studies done on salicylate avoidance, 75% of patients of researchers Warren and Smith either had cleared skin or considerably improved symptoms after being on a low salicylate diet for a 2-month period. And that's Warren, RP and Smith, challenge test battery in chronic urticaria in the British Journal of Dermatology. And I'll share all the links there. Thank you for listening, but make sure that you go to the link below to find out how you can win yourself a £500 luxury budget. And I'll be back with more organic investigations. Thank you.